President Trump has made no secret of his desire to see a COVID-19 vaccine soon, ideally before the November election. How worried are you, Bill, that the approval process is being hijacked by politics?
Well, that would be a tragedy. And any suggestion that, a politician, helped create the vaccine or it's faster because of a politician is a very dangerous thing. We saw with the completely bungled plasma statements that, when you start pressuring people to say optimistic things, they go completely off the rails. And so the FDA lost a lot of credibility there. Thank goodness the companies are saying that the FDA's open-mindedness to be asked for an emergency use license before there's efficacy data. They're not going to seek that shortcut.
Do you still trust the FDA?
I think in the FDA, there's a lot of professionals. Historically, just like the CDC was viewed as the best in the world, the FDA had that same reputation as a top-notch regulator. But there's been some cracks with some of the things they've said at the commissioner level. Hopefully the staff isn't pulled in that direction.
So it sounds to me like you're harboring perhaps some reservations. What about the CDC? You made reference to the reputational damage that's been done to the CDC. Can you take what the CDC says to the bank any longer?
Well, the CDC is largely being written out of the picture because you have people at the White House who aren't epidemiologists, saying what a great job they've done. And so it's no longer a set of experts. The CDC actually did make some mistakes, the way they thought about testing, the way they hadn't figured out to bring the commercial providers in. There's a number of countries like South Korea who got that testing going very well. And we're very clear that if the result takes more than 24 hours, you don't reimburse for that. It's got to be a timely result.
One of the big risks in politicization is public confidence. Polls show a third of Americans will refuse to get vaccinated, and a majority of Americans believe a vaccine is being rushed. Has the damage already been done?
I hope not. These companies are very professional, and the benefits of the vaccine here are very dramatic. After all, not just on the health front, but the economic front, the education front. We need to bring this pandemic to a close. And thank goodness that we have this private sector expertise that we want to shape into a global public good that gets to everybody on the planet. I think some people won't be in the first wave to take the vaccine. They may take a wait and see attitude, but I do think over time we will be able to get to the majority of the population to get to a level where the transmission slows down very dramatically.
Americans, and for that matter, Bill, citizens of the world, have been put in this awkward position where they may find themselves more trusting of what they hear from the private sector, from the companies developing these vaccines, as opposed to what they hear from this government or perhaps other governments. Given the accelerated timeline on which these vaccines are being developed, how confident are you that they'll be not just effective, but safe as well?
Well, these vaccines are going through this phase 3 trial where you look at the efficacy and you look at all the medical records to see if there's any adverse events. The companies have their reputations. Many of these companies are doing this on a not-for-profit basis, so there's not some big profit upside to many of the companies involved, including the ones that will have the most scalable, low-cost vaccines, which is 4 of the leading 6 companies here. So, vaccines are complex. There's often rare side effects, even for the vaccines that have dramatic net benefit. We're all going to be looking at the data, but a safe vaccine, I think, is very likely to come out of this R&D work.
Here's an issue I know you've put a lot of thought into. Rich countries are spending billions of dollars to put their citizens at the front of the line for a vaccine. Where does that leave the rest of the world?
Yeah, this is a very important point, because whether it's from a humanitarian point of view or strategic leadership point of view, or just preventing the epidemic coming back to the U.S. again and again and again, we need a plan to get the vaccine out to the entire world. And the U.S. has been really strong at funding R&D and trials. The U.S. has put more money into that, primarily through BARDA, than all other countries. So that's really good. The thing that the U.S. hasn't done is we haven't participated in coming up with factories and procurement money for the rest of the world. And so when we do that, and I think the Congress in both parties sees that as a priority, when we do allocate money for that, then people see, okay, the R&D thing is coupled now with this sense that we care about the other countries and want to bring this to a close. Somewhere in the 8 to 10 billion range would fund these international activities. Our foundation is making sure that we have factories, including from the high volume Indian manufacturers, that are available to also make these vaccines.
Bill, you're talking, or you have talked, about building a coalition of governments, of businesses, and of development banks to organize and finance vaccinations for the world's poor countries. How realistic is that in today's climate of beggar thy neighbor nationalism and regionalism?
Well, the only country that hasn't shown up for those discussions is the United States. And as I said, because the Congress has always made the U.S. a leader on global health, we did smallpox eradication, our HIV generosity, which was started under President Bush, but has been bipartisan, has been phenomenal. People are still expecting us to fill that vacuum. And of course, whether it's 8 to 10 billion is a percentage of what we're spending domestically, that's not even 1% of what's likely to be supplemental type aid. So we need this to all come together. The sooner, the better. But other countries, including all the European leaders, have stepped forward with generous contributions. It's not enough without the U.S. being there. The world's not used to this vacuum of leadership.
Is there a single organization that can manage a program on that scale?
Yes. The private sector companies have the expertise to do the trials and do the manufacturing, and we have, they've stepped up. The distribution of vaccines, rich countries logistically, that's not a huge problem. As you say, it's probably more limited by the attitudes of the people there. For the developing countries, an effort called Gavi that the U.S. has been a big backer of buys vaccines for the poorest countries and gets them out to all the children of the world. And that's brought childhood death, yearly death of children, down from over 10 million a year now to less than 5 million. So it's a great organization. The U.S. Congress knows it well and has backed it. And they'll, working together with other agencies, they'll have the lead on this procurement piece and cooperating with the individual countries for the distribution.
I'm assuming, Bill, you've approached the Trump administration for support for this global manufacturing and distribution plan. How responsive has the U.S. government been so far?
Yeah, I'm talking to Republicans and Democrats, Congress, executive branch. When it looked like there would be a supplemental bill, it looked like at least $4 billion for the vaccine was going to get into there. Now it's not clear whether there'll be a supplemental bill, which is unfortunate because that would have been a great vehicle. Because when we talk about ending the U.S. epidemic, that global piece has to be part of that overall picture. If there's not a supplemental bill at some point, I do think there'll be an opportunity to have that money come forward. It's literally the billions you have to spend to save trillions. So it'll be the highest impact part of whatever allocation gets made.
Can we unpack that cost for a moment? Trillions. Walk me through that. If the United States doesn't step up with money, if this doesn't get organized fast enough, if vaccines aren't manufactured and distributed around the world at the necessary pace, what's the cost? How do you measure it beyond the dollars and cents?
Well, trillions is about dollars and cents, but the damage goes way beyond that because the loss of education and the stress that people are under. But the world economy is, close to $10 trillion impacted by what's gone on so far. Back in 2015, when I talked about the risk of this, I said, that it would be over $3 trillion. And, I was clearly not, even painting as dire a picture as turned out to be the truth there. So the every month we save on bringing this epidemic to a close throughout the entire world is a month of really awful things. You can see that through economic figures, mental health figures, the deaths that are caused directly. So many things need us to get back to where we were. And the vaccine and generosity to view that as not just for the rich countries is central there.
The Gates Foundation has documented the economic catastrophe that COVID-19 has produced. Bill, what if the recovery out of this catastrophe is K-shaped, which is to say one half of industry and society emerging from the pandemic strong and possibly stronger than before, and the other half weaker and falling further behind?
Well, as long as the disease is out there, things like tourism, restaurants, a lot of small businesses will be disproportionately affected, whereas office workers, where the virtual connections has actually meant that their loss of productivity is actually quite modest, they'll continue to have their job and be able to be fairly productive. And so the inequity of this, whether it's between citizens in the country, blue collar versus white collar, blacks experiencing a higher sickness rate than others. Poor countries can't borrow money and spend money like the U.S. and other rich countries have. So almost every dimension of inequity has been accentuated here. And that just takes us back to we've got to bring this thing to a close. And then you can have the tourism and the travel and the sports and the variety of things, get back to where we were before this.
The conspiracy theorists who believe that you helped to create and spread the coronavirus might be easy to dismiss if there weren't so many of them. Has that notoriety become an impediment to your efforts or the foundation's work yet?
Well, it's so crazy, to suggest the opposite, which is, we make vaccines and that has saved, millions of lives, to somehow say that the vaccine in general is malign or that, the deaths aren't really taking place. It's surprising to me how interesting that is. So it spreads far more quickly than the truth. The big concern is that if that means that the protection of others, like wearing masks or a willingness of enough people to take the vaccine, then it absolutely does make things worse. And the idea of how should these social media platforms try and avoid being the source of these sort of weirdly interesting falsehoods, that's a debate or discussion we're gonna have to continue to have.
One casualty of the breakdown in America's relationship with China is collaboration on virus research and virus containment. Do you share, Bill, the mistrust of China's intentions?
Well, the U.S.-China relations have gotten very complex, and of course, as one side doesn't trust the other, then the other side does things that you can get a negative spiral. That will be a complex political issue. I do think there are cases where we can have win-win, where we're working on solving medical problems, working together on climate change innovation. So I'd hate to see this, what some people talk about, this complete decoupling. I think that would be a lose-lose.
You've been a steady advocate for engagement with China and even for interdependence with China. Do you find yourself, given what you've seen and what you know, any less willing to engage, any less in favor of interdependence?
Well, I wouldn't say we're interdependent. We benefit from each other in terms of, the U.S. sells jet engines and entertainment, and we used to want to sell, expensive chips that would create high-paying jobs. And so I think you have to really decide where is there still mutual benefit. I doubt, and I don't think that's come down to no mutual benefit between two countries that are, and I fully understand this, increasingly wary of each other's behavior.
Should the United States be as wary as it has become to take steps like the one to which you just alluded, to ban the sale of certain high technology to Chinese companies?
Well, you have to think through, forcing them to make their own chips means that if you have a confrontation in the future, not only did you give up those high-paying jobs, but you forced them to be completely self-sufficient. So, was that beneficial? It takes very smart people who don't just want to talk in terms of slogans or think in terms of us versus them.
What's the one thing which is to say the world, should do to prevent the next pandemic?
Top of the list would be that we do the equivalent of war games, where we sit down and look at various scenarios and say, okay, what is the checklist of activities? We saw in this pandemic, the countries that got the diagnostic capacity going and actually did think about travel, unlike the United States, mistakes in that area, they got their testing going. And so both within their country and people coming in, they had testing and quarantine capabilities that meant that the numbers, say, in a country like South Korea, never got, to anywhere near what they did in the United States, where we let it get to such a level that even if we were good at contact tracing, it wouldn't have been possible to do.